Welcome to Dr. Balga's podcast for the Curious Doc. Today, January 24th, 2026. This video is on a New England Journal of Medicine review article titled Physiologic Pacing in Heart Failure, published 3 days ago on Jan 21st online. What is CRT or cardiac resynchronization therapy? It is the pacing that restores coordinated contraction of ventricles in selected heart failure patients. Why is CRT now called cardiac physiologic pacing? Guidelines use cardiac physiologic pacing to include both biventricular pacing and conduction system pacing approaches. Who is a typical candidate for CRT? Patients with heart failure, reduced left ventricular ejection fraction, and either wide QRS or high anticipated ventricular pacing burden. Which ECG patterns benefit most? Left bundle branch block with a QRS duration of greater than or equal to 150 milliseconds generally shows the greatest benefit. What if QRS is narrow? Across multiple trials, benefit is often negligible when QRS duration is about 130 milliseconds or less. What is biventricular pacing? Traditional cardiac resynchronization therapy using right ventricular lead plus a left ventricular lead via the coronary sinus to pace both ventricles. Where is the LV lead placed in biventricular CRT? Usually in the lateral or posterolateral coronary sinus branch to capture the LV epicardium. What is conduction system pacing? Pacing that targets the His bundle or left bundle to engage native conduction system. Why consider left bundle branch pacing? It often has a higher implant success and lower, more stable pacing thresholds than His bundle pacing. What is His bundle pacing? A physiologic mode that stimulates the His bundle to preserve near normal ventricular activation. What is pacing-induced cardiomyopathy? It's a decline in LV function related to frequent right ventricular pacing causing dysynchrony. When does CRT help prevent pacing-induced cardiomyopathy? In patients with left ventricular ejection fraction equal to or less than 50%, who are expected to have substantial RV pacing, example atrioventricular block. What outcomes does CRT improve? Trials show improvements in symptoms, quality of life, LV remodeling, heart failure, hospitalization, and in selected groups, survival. What is reverse remodeling? That's the reduction in LV volumes with improved LVEF after resynchronization. What is the typical non-response rate? About 1/3 of the patients may show limited remodeling response despite appropriate implantation. Why might a patient not respond? Non-left bundle branch block morphology, shorter QRS scar at the LV lead site, suboptimal lead position, or insufficient biventricular pacing percentage. How much biventricular pacing is usually targeted? High percentages are preferred. Many aim for equal to or greater than 95% pace beats when feasible. Do women respond differently to CRT? Evidence suggests women may benefit at shorter QRS durations than men. Guideline thresholds reflect this nuance. What is hot CRT? That's His bundle optimized CRT, combining His spacing with LV coronary sinus spacing in select cases. What is LOT CRT? Left bundle branch optimized CRT, combining left bundle branch pacing with LV coronary sinus spacing in select cases. Can CRT patients get MRI? Some systems are MRI conditional under manufacturer-defined conditions. Device-specific checks are required. Is lead extraction possible? Yes, experience is growing, but extraction complexity rises with long lead dwell time and varies by lead type. Does conduction system pacing change cost or battery life? Conduction system pacing may reduce system complexity and procedural time, with potential downstream cost and battery life advantages in some settings. What trials are ongoing? Multiple moderate to large randomized trials are comparing conduction system pacing versus biventricular pacing for major clinical outcomes. What is the big future question? Whether conduction system pacing will match or outperform biventricular pacing in broad CRT populations as randomized evidence matures. These are some clinical trials related to CRT and physiologic pacing. Hit pause and read at your leisure. Podcast brought to you by masterbedfacts.com. This podcast is for physicians and healthcare providers. If you enjoyed this video, please like, subscribe, and forward to your friends.